and welcome to this webinar. My name is Bengt Mattson. I'm a policy manager at Lif, the Swedish trade association for the research-based pharmaceutical industry. We arranged this webinar together with the trade association Vaccines Europe. And this is the second webinar in a series of webinars on AMR that we do organize during the Swedish EU presidency. Today we are going to talk about national AMR action plans and immunization programs that we see as key policy priorities in the fight against AMR. And AMR, that's antimicrobial resistance, and it's a growing threat that requires global collaboration. It has been declared by the WHO as one of the top global public threats facing humanity. AMR is estimated to cause approximately 33,000 deaths in Europe alone. And the emergence and spread of drug-resistant pathogens that have acquired new resistance mechanisms leading to antimicrobial resistance continues to threaten our ability to treat common infections. A very broad strategy involving initiatives and actions in many different areas is needed to successfully manage AMR. Evidence clearly demonstrates that vaccines and immunization programs are critical in helping to combat the growing AMR crisis by reducing antibiotic consumption. The upcoming revision of the Council recommendations on AMR provides a great opportunity to update European policy recommendations and incorporate best practices based on lessons learned over many, many years. And it is time for Europe to show leadership. Strong and robust vaccination, immunization programs is together with other crucial actions in the fight of AMR, for example, hygiene, sanitation initiatives, rapid and accurate diagnostics, new reimbursement models for existing antibiotics, and very strong push and pull incentives for new antimicrobials. All of these are key for successfully battling AMR. It is important to remember that without access to effective antibiotics, advanced cancer treatments will not be possible. A simple knee surgery cannot be performed. Neonatal hospital care would actually be jeopardized. So AMR is the top pharmaceutical challenge, and all actors must join forces to stop this silent pandemic. As already stated, today focus on AMR, action plans, vaccination, immunization programs that are key policy priorities in the fight against AMR. Initially, we will be presented an EU overview of the inclusion of vaccination in AMR, in the national AMR plans. That presentation will be done by John Paget from NIVEL, the Netherlands Institute for Health Services Research. Then we will listen to industry's perspectives. They'll be presented by Sibilia Quilici from the Industry Trade Association Vaccines Europe. Our final presenter before we enter into panel discussion is Jaime Pérez from Spain, the president of the Spanish Association for Vaccination. And he will share some best practices with us and reflect, of course, on the situation in Spain. Jaime will join us via link from Spain, whereas both John and Sibilia is here in the studio together with me today. During the session, please ask questions, make comments on the different presentations. You see a little space below your screen where you could type your questions. Please do so. I'll follow them on this little iPad here, and of course we'll give them to the presenters. So without further ado, please welcome John Paget for his EU overview of inclusion of vaccination in national AMR plans. Let me, go ahead, John.
Thank you, Bengt. I'd like to thank the organisers for the invitation to give this presentation. I think it's really important that that we're discussing this topic of AMR, especially as Sweden has got the presidency of the Council of the EU for the current 6 months, and this is going to be discussed at the council level. And another point to be made is that Sweden is really a leader in AMR in Europe, so it's a good theme that Sweden and also the other Nordic countries are taking this forward. So what I'm going to be talking about is the inclusion of vaccination in AMR national action plans. Originally it was a global review, but we've also extracted the data for Europe. Let me see if I get that right. Yeah. So in terms of background, WHO has published an action framework document, which you can find on the internet. And one of the important elements of this action framework is influenza vaccination. And vaccination works on the left-hand side. You see how it works. So you vaccinate the population, which prevents infections, and also the use, and therefore the use of antibiotics. And so by reducing the use of antibiotics, you reduce antimicrobial resistance in the population. So it's seen as an important measure to reduce AMR in the population. And one of the recommendations is that vaccination should be included in the national AMR and action plans. And so what we did is we reviewed the AMR national action plans. And so at the time when we did the review, it was in 2021, there were fewer action plans available on the WHO website. But as of November 2022, there are 170 of them. These are action plans which have been reviewed by WHO and are posted on in this library. And from the action plan, from the WHO framework action plan, they cite the following vaccines as vaccines to be used to have an impact on AMR. So they're listed there: pneumococcal vaccination, influenza vaccines, Hib, typhoid, rotavirus, and measles. And so that was the focus of our analysis. And as I said previously, reduction in antibiotic use, which has an impact on AMR. So when we carried out our analysis in July 2021, there were 70, well, there were actually more than 77, but because there were some language limitations, so we only analyzed the 77 where we could follow the languages. There were a few more which we couldn't review. I think there was, for example, like from Korea. And so we took the 77 AMR national action plans, which we reviewed, and we looked at whether vaccination was included in these plans. So in terms of results, so the good news is that 87% of countries in the national action plans included vaccination, any vaccination, just mentioning vaccination. This is especially well represented in the Americas, so across the North and South America, actually in Africa and also in the Middle East, and less well represented, so there were some countries in Europe and in Asia which didn't mention vaccination. Oh yeah, and we also looked at whether there was an objective to capture the role of vaccines, and that was 26, and there's an example in Iran. And we also looked at whether vaccination is presented as an example to reduce AMR, and that was in 41 countries, and there's an example for Australia. We also looked at the correlation between, I have difficulty reading this, as an objective on vaccination and whether specific vaccines are mentioned. And so we correlated that with income levels. And what we found is just mentioning vaccination was equal across income levels. And for specific vaccines, so for example, they mentioned pneumococcal vaccine or influenza vaccination, it was more frequently reported in higher income countries. So for this presentation, we looked at Europe, and my colleague updated the analysis for Europe. So she rechecked the whether there were national action plans, And as of March, so there were 36 out of the 53 countries in the WHO Euro region that had an action plan. So, but when we carried out our analysis in July 2021, there were only 14 countries that had a national action plan on AMR. And I suspect the increase is to do with COVID. And I suspect that countries are now, there's more of a focus on AMR more recently. So there's some sort of catch-up. So when we were making this review, we were in the midst of the COVID pandemic. And so when we carried out our analysis in July 2021, 10 countries out of the 14 mentioned vaccination somewhere. And these are the 4 countries that did not. That was the Netherlands, Germany, Denmark, and Czech Republic, or Austria. And we also looked at whether specific vaccines were mentioned. That was in 5 of the countries. And on this map, we didn't include Tajikistan and Turkmenistan. We also looked at so when countries reported specific vaccines, which vaccines were reported, and the top list is those which were recommended by WHO. And what you see here is that pneumococcal vaccination and influenza vaccination is the most common of the 17 countries that reported specific vaccines. Sorry. And if you look in Europe, again, it's the pneumococcal vaccine and the influenza vaccine. So in terms of conclusions, so globally, vaccination is frequently mentioned in AMR plans in 87% of the countries. However, vaccination is not always recognized as a main objective. So that's something that could be improved. In the WHO Euro region, vaccination was mentioned in 10 out of the 14 AMR plans which we reviewed, which is a good thing, 71%, slightly lower than the global average. And most of the attention was focused on pneumococcal and influenza vaccination. And our recommendation is when updating the AMR national action plans, there need to be more strategic objectives to increase and promote vaccination, and more focus on the vaccination programs and the integration of specific vaccines. So for example, pneumococcal and influenza vaccines. So if you'd like more information about the results of this review, we've published this in BMC Globalization and Health. And thank you for your attention.
And thanks a lot, John. And please stay. First of all, just perhaps for the sake of clarification, I think in most people's minds it's kind of easy to understand that vaccination against a bacterial infection would potentially lead to decreased use of antibiotics and hence potential reduction in the spread of AMR. But also for viral infections, and I presume you would say that that's due to that we reduce the risk for secondary bacterial infections. Exactly. Yeah. Exactly. So just to clarify that. But before you leave the stage here, it's kind of clear that there is room for improvement when it comes to inclusion of vaccination as a tool to fight AMR in the national AMR plans. In your opinion, just briefly, we'll come back to this, I presume, in the panel discussion, but what needs to be done?
So, first of all, there needs to be more AMR action plans, but that was our conclusion in July. But it seems that there's many more that have been published. So, it has to be said, I hadn't realized how much change had occurred in the last 18 months. And I think that's a very positive development. And hopefully in the new national action plans, there's more frequently a mention of vaccination. But so based on our analysis in July, so there should be more national action plans. That was one of our recommendations. And there should be more specific objectives about vaccination, and also more specific mention of the specific vaccines and how they can be integrated to the plans. But it's possible that those recommendations are now outdated. But that was our recommendation in July 2021. Yeah.
Thanks a lot, John. And you'll come back in the panel discussion.
For the discussion.
So don't take that one, please. So with that, I invite Sibilia from Vaccines Europe up here to give what I've called the industry perspective of these things.
Thank you very
Please.
much. Thank you, and I'm very pleased to be here today to discuss about the role of vaccines and vaccination to prevent antimicrobial resistance. Very briefly, with regards to Vaccines Europe, so we are part of FPA, the European Federation of the Pharmaceutical Industry and Associations. We represent the innovative vaccines companies that are operating in Europe and of all size enterprises. And our mission, which is really specific to Vaccines Europe, we are 30 years old. We are fully dedicated to vaccines per definition. And our aim is to drive a sustainable and resilient vaccine environment in Europe by protecting the people against infectious disease at all stages of life. We had an increase in membership over the last years linked to COVID-19, which has really created a regain of interest in the vaccines field. So I'm not going to go back to what has been actually well explained by John just before me, but vaccines help prevent antimicrobial resistance. There is a ton of scientific literature today and also clear positioning from our supranational organization. To mention but the least is WHO. So WHO is clearly for us an important body because clearly states the importance of vaccines and vaccination in the fight against antimicrobial resistance, and in the plan that has been also raised by John, there is clearly defined goals, priority and actions. And this is so the same document referring just to say that this is driving the international commitment with regards to the engagement on R&D in vaccines to fight against antimicrobial resistance. And the WHO really positioned 3 goals here. The first one is to expand the use of licensed vaccines to maximize impact on AMR. So we have many vaccines today to fight infectious diseases across the lifespan, so for pediatrics, adolescents, and adults. And while pediatrics are fairly well implemented, the coverage rates for the rest of the population is not optimal necessarily. So WHO, particularly in this report, mentions the need to expand the use of MMR, measles, Haemophilus influenza B as well for the pediatric rotavirus vaccines, but also influenza and pneumococcal vaccination if we look at the adult population. The second goal is to develop new vaccines that contribute to prevention and control against AMR. I will go back to that, but there are clear challenges here that need to be tackled in order to accelerate the development of these vaccines. And the third goal is expand and share knowledge of vaccines and impact on AMR. I mean, we know the role of vaccines to prevent infectious diseases, to protect the life of the people, to contribute to reduce resource use of the healthcare system, for example, contribute to the resilience of the society, the economy, and the healthcare systems. But little is said about the impact that vaccines can also play with regards to AMR, the fact that not only we save you from infections, but also the next big threat is not the next big threat because we are clearly in the middle of it, being antimicrobial resistance. We need to reduce the use of antibiotics so that they are safeguarded for when they are most needed. And this is clearly important to communicate on this. So from a vaccine industry standpoint, where we are at, we have published end of last year the first ever pipeline review of the 15 member companies that are part of Vaccines Europe. And this pipeline review is really interesting because it demonstrated a strong regain of interest in the development of vaccines, new vaccines. We have 100 vaccines candidates in this pipeline by mid last year, which is unprecedented and likely due to, as I mentioned already, the regain of interest due to COVID-19. From this pipeline, nearly half of the candidates actually address diseases for which there is no vaccines today that has been registered. So clearly diseases for which treatment is the only options that we have. Also of interest from this pipeline is that 80% or 80 candidates, vaccines candidates out of this pipeline are targeting adult population. So this is also important because it does demonstrate the shift that we are going to see over the next years with regards to immunization priorities. Not only children, but the rest of the population to face what is going to come next in terms of challenges, whether it is related to more respiratory tract infections, as an example, or whether it is coming from the climate change and infectious diseases that will come with it. And another point that is of interest is also the vaccines that are being developed targeting specifically antibiotic-resistant bacteria. So we have 11 vaccines candidates here tackling 6 antibiotic-resistant bacteria that are all listed in the list of resistant pathogens needed to be tackled by the WHO. So as I mentioned, and this is to connect as well to the goals that are set up in the Immunization Agenda 2030 by WHO, is that part of this pipeline address diseases for which there is no vaccines, and some of them actually include the resistant bacteria, and other part of the pipelines cover for vaccines that have already existing, but that are going to be improved in augmenting, for example, increasing the protections against the strains, so like influenza, pneumococcal, or HPV, for instance, where we can really make the vaccines better and more protective against strains, and thereby even better in terms of preventing the use of additional antibiotics. The vaccines are very complex to develop. I think this is something that needs to be mentioned and repeated. They are very complex. It's one of the most complex biological products to develop and to manufacture and to implement on the national ground. It takes between 10 to 15 years in terms of research and development process. The attrition risk is really, really high as well. On less than 10% actually of the vaccines in R&D will end up in the market. And specifically for resistance, we are basically following the state of scientific knowledge. And this is even more complex in an environment where you have evolving resistance. So research R&D for vaccines in the context of AMR is particularly challenging. Also for a market where the demand sometimes is limited. So you need to, there is also this balance in terms of return on investment, in terms of sustainability of the work being done here, ensured by the demand. So we need to encourage really vaccines research to include both broad population vaccines access and at-risk population. We are entering in a different environment. When we think about vaccines, it's always for broad population, it's mass population. And this is clearly what is happening there. But it's also, with regards to antibiotic-resistant bacteria, for example, hospital-acquired infections, which is a much different population, much smaller, and will be part of a completely different business model, for instance. So we need to recognize this difference, and we need to ensure that the incentives supportive the R&D in vaccines against AMR are adequate. And also there is need for a systemic change in the recognition of the value of immunization here. So I keep repeating in every instances I'm in is in relation to sustainable financing for prevention and immunization policies, because this is absolutely critical if you want to have a healthy vaccine ecosystem. So with regards to financing, today it's important to say that only 0.5% of the healthcare budget is dedicated to immunization, to cover everything, so procurement, R&D, campaigns, education, infrastructure, etc. And this is clearly not enough, and we see that it is not enough because implementation of vaccination programs such as influenza is failing in Europe. And we need also to increase the awareness of our healthcare professionals and citizens with regards to the value of immunization, and here more particularly with regards to the value that vaccination can play in the fight against AMR. So when we look at the opportunities that we can get from the Council recommendation on AMR, I mean, we need to leverage as well what has been done in the past. I mean, we are not coming from nowhere. We have the 2019 Council conclusions that created the engagement from, at the member state level. Things are happening. We see that the member states are actually putting in place national action plans against AMR, and we need to go beyond that. Vaccines have already found their place in the Council conclusions back to 2019, but we need to go beyond that. It's not finding the place in the text. We need to have concrete goals, objectives, and priorities. And here I believe that we can really acknowledge and implement the WHO Immunization Agenda 2030, its goal, objective, and priority actions by leveraging vaccines to reduce antibiotic use and prevent antimicrobial resistance. And when we talk about immunization, we need to be really comprehensive. So we need to include immunization strategies into AMR national plans. That's great. But then you need also to define vaccination coverage rates, targets, and objectives by pathogens. You need data. In the absence of data, you don't know what you're doing. You don't know whether what you put in place works. So we need absolutely those data. We need to ensure national monitoring of those vaccination coverage rates in order to implement appropriate public health measures to reach the national targets for vaccines preventable infections. We've seen it in action with COVID-19. We need to expand it to other infectious diseases. We need to organize awareness campaigns towards the healthcare professionals and citizens. I already covered this, and establish a sustainable immunization financing for the immunization policies. But then we need also to invest much more in research into new vaccines against AMR, antibiotics resistance bacteria. So new mode of actions, engaging all the players, all the stakeholders, public, private partnerships are absolutely critical here. But we also need to investigate on innovative funding mechanisms and incentives dedicated to boost R&D of new vaccines against antibiotic-resistant bacteria. This is really important because we are in a completely different model here. The vaccine industry is different from, I would say, the therapeutic side of the industry. So the way you actually look at funding mechanisms for vaccines has to be specific. Incentives have to be specific. So we need innovation here in these mechanisms. Thank you very much.
Thank you, Sibilia. And before you leave, you talked about, and we're all talking about, of course, having programs, vaccination programs, immunization programs in the AMR plans and so on and so forth. But somehow, of course, that doesn't solve the problem. They need to be implemented. And I presume you could probably point both to like lack of financial resources, lack of infrastructure. So could you just elaborate a little bit on the weaknesses for actually seeing accurate implementation of the programs in the different countries?
So I think that as you mentioned, and it was said, including immunization policies as part of the AMR action plan is not enough. You really need to have concrete actions which are linked to the immunization policies at large. So basically, we have first strong immunization policies that needs to be happening at the member state level, and this one needs to serve actually the AMR action plan. But the AMR action plan can refer to the immunization policy saying, we need you to be performant. So I think here we have a connection that needs to happen, because you can be successful with regards to the fight against AMR only if you manage to implement your national immunization programs. That said, we know what needs to be done. It's complex. We know that immunization, vaccinating the population is a very complex environment, and we know what needs to be done. We know that we need funding. We need to fund and finance. So member states need to prioritize funding for their immunization programs. Sustainable financing is absolutely critical. Then you need to have data. I repeat, data is absolutely critical, because if you want to know where you're at, whether you protect your population at the right level. If not, what is at stake? What is the risk of a potential outbreak, by the way? What is the population that needs to be prioritized, etc.? You need to have clear data. So the European health data space in that regard is an important platform that we need to look at, because we cannot work in a blind way today. It's insane. It would be really insane to stay in the state. We don't know what is actually the most recent uptake of influenza vaccination today. So if we want to fight against AMR with the support of influenza vaccination, we just don't know where we are. Do we need to increase by 10%, 20%, 30%? So that's what we need. So for me, immunization financing is critical. Data, timely monitoring of the vaccination coverage rates, strong surveillance systems is absolutely needed. And then education of our healthcare professionals and our citizens.
Super. I presume we'll come back to a lot of this during the panel discussion. Thanks a lot, Sibilia. And now I'm going to invite Jaime Pérez. You're on link. I hope technology will be kind to us now. And Jaime, you just say next slide, please, and I'll swap the slides from here in Stockholm. So please, Jaime, go ahead.
Okay, perfect. First of all, thank you for inviting me to this webinar or to this meeting. I am president of the Spanish Vaccinology Association, and besides that, I am a member of the Spanish NITAC. So I have experience about the NITACs in Spain. First, well, I think Spain is not a good example of controlling the antibiotic resistance. As you know, we had a very big problem with this. And the first steps is that taken were just to stop buying antibiotic easily in pharmacies. Right now, it has become a really difficult process to buy an antibiotic in pharmacies, but years ago it was really easy. Right now it's almost impossible, since my last experience was just going to some pharmacies and being myself medical doctor and trying to get an antibiotic. They just told me to go to other medical doctor and they to give me a prescription. So we have changed about that. So next slide, please. In Spain, with this problem, we had one of the papers published after the introduction of the pneumococcal conjugate vaccines. We evaluated and we saw that after introducing pneumococcal 7-valent and 30-valent, we saw reductions around 50% of antibiotic resistance. It depends very much of the research, but about that. So that was a very good experience about antibiotic resistance, especially because we had a very big problem with serotype 19A. So after the introduction of PCV13, we went with that problem really very well. Next slide, please. Of course, Spain is not an exception. Vaccines have demonstrated that they are a very good tool to reduce the antibiotic resistance. This is a study published in the United States for in New England after PCV7 introduced, and you can see how the incidence of cases after the introduction was a very big reduction in antibiotic resistance. Next slide, please. And I'm not going to say any more about this, but there are a lot, not just the vaccines that we already have, and that we have a paper we have a role to do with the implementation of those vaccines in a better way to reduce the antibiotic resistance. But we have a pipeline of many vaccines trying to fight against antibiotic resistance. Next slide, please. But my point here is that my colleagues have been speaking about the national action plans. That's very interesting, and we have a very good research done by our former colleagues in the introduction. But about what is the role of the vaccines in the national action plans of antibiotic resistance. We have seen in the first presentation the national action plans included vaccination, and not just for Europe, but for the rest of the world. And we have seen that sometimes in a very weak way, because it's a very, very not defining objectives clear, etc. But they are included in most of the national action plans. Next slide, please. In our case in Spain, the national action plan that was published is for 2024. We have just a mention of the antibiotic resistance in one of the parts of the plan, but it's not really, there is not objective, so that's something to improve, of course. And in the action lines, vaccines are cited, but not with objectives specific. But my point, since I belong to NITAC, is not just the national action plans, but what point are the NITACs included in the national action plans of antibiotic resistance? Next slide, please. For example, when I review for this presentation our document for the introduction or change of the national immunization program in Spain of possible immunization immunization schedule, I realized that there was not at all the word antibiotic, of course not antibiotic resistance. I mean, among the questions evaluated is included preventive measures and alternative therapeutics. I mean, if there is something, if the disease has a treatment, or if the disease has a possible, another possible screening, or other preventive measures, you should consider that, because those diseases with treatment or with other screening to prevent the disease has a less priority to introduce the vaccine. What is the effectiveness of the alternative preventive measures, or is there effectiveness treatments of the disease? But the word antibiotic resistance, as I told you, is not there, and the word antibiotic is not there. So, next slide, please. I think that we work, but it's not just the point of the national action plans considering vaccines, but it's the point about the NITACs consider antibiotic resistance and antimicrobial resistance, because if not, we are not going to go together. We are not going to. We could have many vaccines, very good vaccines to fight against antibiotic resistance, but we don't have the possibilities of changing if we are not going to consider. So we have a good tool to prevent antibiotic resistance, but most national action plans include vaccines as part of the tools. But in our NITACs of this process, I have been reviewing the evidence and the literature, and I haven't found any research about that. In the case of Spain, that I am very concerned and I'm very aware, is not that case. Are the NITACs aware or concerned? Do we have data about antibiotic resistance? Do they consider antibiotic resistance to change the immunization schedules? Are the antibiotic resistance between the regions are less integrated in the evaluation of the burden of disease. I mean, I think I shouldn't be as a specific point, but it should be considered in the burden of disease to change the national immunization program. In Spain, the first time to introduce this concept was in a document evaluating the flu vaccine for children, but it was just in an informative way and not giving that to more important. And recently, our association, the Spanish Vaccinology Association, has created a group for antibiotic resistance in order to increase awareness and in order to trying to work together, the vaccinologists and the people dedicated to antibiotic resistance. Next slide, please. So as conclusions, I think that we need more information on whether the NITAGs are aligned with the national action plans. It's not just the national action plans include vaccines, it's too if the NITAGs include antimicrobial resistance. Vaccines can be an important tool in the prevention of antimicrobial resistance that should be included as one of the possible criteria to change or to complement or to improve the national immunization plan. We need to work together, and some of us who are dedicated to vaccines, especially NITAGs, should be part of the national action plans, and possibly some of the people working on the national action plans should be in the NITAGs. Initiatives such as those of the Spanish Vaccinology Association, I think, are useful to raise awareness. Next slide, and last. Thank you very much for your attention.
Sorry, thanks a lot, Jaime. And just to secure that everyone follows the discussion here, the NITAGs, the National Immunization Technical Advisory Groups, are of course essential in setting up the different programs in different countries. And I guess your recommendation here, Jaime, as I understand it, would of course, one of the recommendations coming from your experiences would be to secure that, of course, the NITAGs also, when they do their work and all in their documents, so to speak, that also the link of the vaccination programs to the fight of AMR is crucial. So
the point is that vaccines can be in the national action plans, but if antimicrobial resistance is not in the specific objectives of the NITAGs, we are not going to go through the process of changing the things. We have to work together, NITAGs and national action plans.
Thanks a lot, Jaime. And I see here in some comments on in the chat, so to speak, that some people lost connection for a short while. I hope that they are back.
They should be back.
They are back, and sorry for that if you guys who lost connection for a short while. Please, Sibilia, John, come up, and Jaime, you stay where you are on the link. Let's move into the panel discussion, and I like to kick off from listening to Jaime here from his Spanish experiences. Apparently, there is room for improvement, and I presume you could say that not only for Spain, and I of course ask you, Sibilia, with your great knowledge of the situation across Europe, is what the challenges that Jaime describes for Spain. Do you see them in other countries as well?
Yeah, I think it's shared across the region. Adding the value, I mean, it was mentioned the NITAGs, how it is integrated also in the national immunization programs, how we actually define the values of vaccines, that the vaccines bring beyond just the direct benefits. So it is really lacking, and is lacking in the full evaluation process of vaccines, in fact. So this is why, I keep mentioning also the different platforms that we have. We have the new European HTA regulation that has entered into force, and here how vaccines will be evaluated and how to integrate actually their contribution in the reduced use of antibiotics, in the prevention of AMR, will be absolutely critical, because this is where, from that, you can translate their value into the national immunization programs. So yes, same across the region. More to be done to integrate the full broad value of vaccines and vaccination in their evaluation process in order to translate at national level.
Super, thanks. And Sibilia, you talked a lot about the importance of data. And of course, we all hope, I presume, that the European Health Data Space Initiative will help us. If I turn to you, John, the research, the reviews you've done, is it easy to find, let's say, good, robust data on the coverage rates of vaccination and all of those things? What is your experience there? Was that a tricky one for you?
That's a tricky one. So one point I think is worth mentioning, maybe for the audience, is NITAG is the National Immunization Technical Advisory Group, and they cover all the vaccines and they make the recommendations for countries. And then regarding, and the NITAGs are at national level, but they also meet at a European level. So there's a network, and they discuss things. So yeah, and this link to AMR is a really good one. So you can bring in vaccination into the national action plans, but I think it's a good idea also to bring it in at the NITAG level. And then regarding data, so
do they have the data needed?
Well, yeah, exactly. So that's a bit of a minefield, to be honest. I mean, like for COVID, we have fantastic vaccination data, and it used to be updated daily, and there's a dashboard. For influenza vaccination, which I know well, it's not very good. It used to be well done, so there was a project called Venice, which was funded originally by DG Santé and then by ECDC, and so they would collect the influenza vaccination rates for all countries in the EU. And for some reason, this project was stopped. And it's a bit of a mystery why it is. I have heard that one of the reasons is that some of the countries didn't appreciate having such low rates of vaccination rates presented in the public domain. So it was a political decision to stop the monitoring of influenza vaccination, which from a research perspective is not the right way to go forward. I think the data should be put in the public domain. It's now very difficult to get vaccination coverage rates for influenza. They also come very late, so it's not compared to COVID. It was very fast, and flu you sometimes have to wait. So for in the Netherlands, for the winter now, the 22-23 winter, we will have to wait, I think it's until like August of this year to get the rates. It's crazy, especially in an era where you have electronic medical records. This data should be available much earlier so that policymakers can do planning. I mean, coming out, just before the flu season is too late. And I think there needs to be a concerted effort at a national level to get better vaccination uptake rates, but also at a European level. And that's a message, I think, to ECDC to collect and present this data and put it in the public domain.
If I build on that, is that the kind of what we would like to see in the coming council recommendations on AMR from the council? Yeah. But I presume there are more things we would like to see in the council recommendations. Sibilia, if you start, and the other guys you could amend then. But Sibilia, if you start in the recommendations, what would you like to see?
I think I listed it in the last slide I presented. I think the Council recommendation really put in perspective what needs to be done. I mean, I think the implementation, I go back to it because we don't need to reinvent the wheel. Everything is written in the WHO report, Immunization Agenda 2030. We need to adapt with regards to the needs of the countries, obviously, because WHO is a broad region, so the need of low and middle income countries is clearly not the need of the developed countries. And even within Europe, you have disparities between the west part and the east part of Europe, so it needs to be adapted, but a lot is already being there. So ensuring the implementation, and we go back to ensuring implementation of the national immunization programs. Today, national immunization programs protect, again, 20 infectious diseases across the lifespan. So ensuring that we have the right level of coverage rate for all those diseases, not only because they prevent the threat of the disease for the individuals, but also because they prevent the overuse and misuse of antibiotics, I think is absolutely critical. But you need to know what you're doing.
Yep.
So data, we go back to that debate, is important. Having the right infrastructure to ensure this is happening is also critical. We have a big gap here. We leverage lessons learned from COVID-19. I mean, COVID-19 is an adult vaccination. It's been fastly implemented. That said, I still think that we took too long to reach the high-level coverage rates because we took about a year. It would have been a pediatric vaccines, maybe it would have been faster because the infrastructure was in place. Here we had to build everything from scratch, huge resource use to make sure that we could vaccinate the adult population. So infrastructure for adult immunization is absolutely critical. And then educating. We need to educate. We need to communicate on the value, the broad benefit of vaccines and vaccination to the healthcare professionals so they know why they need to promote the use of vaccines and vaccination, but also to explain well the benefits as well for the citizens. And last but not the least is really related to research and development. This is not we need to accelerate the R&D in vaccines against AMR. Again, with regards to vaccines that needs to be improved, with regards to completely new vaccines that target the list of resistant pathogens. WHO has a significant list of resistant pathogens that needs to be tackled via antibiotics, via vaccines, and here we really need to map out. They also run a pipeline review globally about what is there already. Here we really looked as Vaccines Europe as what the companies that are members of Vaccines Europe are doing as they operate in Europe. There is a lot there already, which is great, but we need more. So we need more. So behind that, what are the tools that needs to be put in place to support R&D in vaccines against AMR?
Super, Sibilia. And John and Jaime, I don't think you will have a lot to add on what you would want to see in the council recommendations, in addition to what Sibilia already listed. John first.
Yeah, so maybe Jaime can comment also, because we're talking a lot. But just briefly to say that national action plans are not only vaccination. There's other issues like which we've mentioned, surveillance. There needs to be a proper legal framework. There's been great improvements in Europe in that sense. In the sense that it's not possible to get over-the-counter antibiotics anymore. There's also public education, there's healthcare, working with healthcare workers, healthcare worker education about AMR, so and vaccination. So it's stewardship is a broad term, and vaccination is one element of that, of a national action plan.
Thanks. And James, any comments from you?
Well, not really any new things. I think that research is very important. Have a national and international data is really important to make awareness of the problem. About what my colleague was speaking about, the national data that could be countries don't want to give in a public way. There are other ways to do that. I mean, if the data can't be get official data. I mean, we have many people in networks, research networks that get, at the end, we have the national data, and national data are published at the end. So it's not just the regular official data, but I mean, sometimes many of the research can be done through networks, not just through the data reported to the ECDC, for example, or things like that. If countries don't want to do that, because I mean that's very dangerous if countries don't want to do that. But at the end, they evaluate and they publish. And if not, there can be a pilot in some countries to make a specific research. So I think data are really, really needed. And besides that, of course, giving targets, specific targets, and making aware that the vaccines can contribute to this. I mean, a vaccine is not going to be used for this, but that can be one of the points that make the change to introduce or to make a broader use of the vaccines if we need that.
Thanks a lot,
Thank you.
Jaime. And for you guys, you've seen a long and good comment from Simone Mancini at the European Sepsis Alliance in your chat in the webinar on the importance, of course, of actually the consequences when it comes to on sepsis from AMR and the extremely value if we could, of course, with vaccination stop a lot of these infections. And before we close, and I'll try to just give some final comments, a question to I don't know who'll pick it up, but there is, of course, this and one of the questions I've seen here is also around: do we really know? Is there evidence that strong vaccination programs actually do, so to speak, decrease the development of AMR? It's kind of easy to understand that it will decrease the use of antibiotics. Is this an area where more evidence would be needed, or is it so self-evident that we should put our resources into other things? Any short comments on that from any one of you?
Yeah, go ahead.
Maybe I can start. But I think there is a scientific logic here where if you reduce the use of antibiotics, you put less pressure on the microbial resistance and for it to develop. So the scientific logic is clearly there. And whether it is linked to therapeutics, by the way, of vaccines, there are also projects, I believe, but maybe we need more, modeling actually the impact of reducing the use of antibiotics with regards to antimicrobial resistance. So this is what is happening because it's really, really difficult. It's really complex. So modeling approach are actually happening in this field. But the scientific logic, I think, is really strong. And this is why you have this international consensus with regards to what needs to be done.
And I think, Sibilia, just as you said, modeling is probably the way to go, because I couldn't really see how you would set up that test protocol to show it otherwise, so to speak. Anything more? Or we agree on that one? Yeah. So with that, guys, thanks a lot. I'll try to sum up rapidly. As we all knew when we went into this webinar, AMR is a growing serious threat that requires several actions. They need to be taken promptly. And one of those actions, as we have discussed and talked about, of course, is to put in place strong and robust national immunization programs, vaccination programs. And in the revision of the pharmaceutical legislation that is ongoing, and of course through vehicles such as the Council recommendations on AMR, EU have something like a once-in-a-generation opportunity to really update the EU response on the AMR threat. And I think we all heard the call for action for Europe to show leadership now. And quite frankly, we cannot wait any longer. We need this to happen. Patients across the globe need to have robust access to vaccines to decrease the threat from both viral and bacterial infections. And if that access is actually granted, that's probably one very important key factor in slowing down the development of AMR. And hence increase the opportunity that effective antibiotics are available when needed. So one of the real important things here today was to, first of all, somehow secure that vaccination becomes part of the national AMR action plans. But of course, that is not enough in itself. We all of you guys have talked about it needs to be more precise, more clear, generating data, things like that, and secure that those programs are actually implemented. And we heard about challenges on resources. We heard about challenges on the infrastructure, but definitely more needs to be done. And the council recommendations, let's hope that they include a lot of these recommendations, if we put it that way. And with that, thanks to our panelists, John, Sibilia, Jaime out link there. And of course, thanks to all of you that have listened to us and take part in this webinar today. Thanks a lot, guys.